Hello and welcome. The small state of Kerala in the southwestern part of India is now reporting roughly half the number of total COVID cases in all of India. Now, you have to remember that we are on the downswing now of the second wave and preparing much better than perhaps we did between the first and the second for the third wave. So there are several questions which are obviously being raised. One is, why is Kerala, the state, seeing so many cases in proportion to other states of India? Second, what do those number of cases mean in proportion to the rest of Kerala and the number of cases and the hospital capacity and the ability of Kerala to cope purely in isolation at this point? More importantly, what does this portend? If we were to look at these numbers and understand them better than perhaps we can, given that data maybe from other states in India is not as easily available in this quality, what is our understanding of this disease and disease progression at this point between the second and third waves, and how do we use this to understand the potential behavior of this disease going forward as it could perhaps or potentially, if unfortunately it does spread to the rest of India. So to answer these questions, I'm joined by two experts, Dr. V. Ramankutty, epidemiologist and public health expert, who also holds a master's in public health from Harvard University, Dr. Rajeev Jayadevan, vice chairman of the research cell of the Indian Medical Association based out of Kochi. Both are in Kerala. Thank you both for joining me. And let me begin with you, Dr. Jayadevan. So first, tell us, Kerala also enjoys a very high degree of vaccination, almost 23%, and you have about 24,000 cases running at this point per day. So in your understanding, what is exactly happening right now?
Well, if you look at the British experience, you will see that if you look at their past two waves, the answer to your question is very clear. They started vaccinating just before the previous wave, and the apparent protection only occurred in the wave after. So which means that the vaccination we give now will only show its true benefits in the subsequent waves. And as of now, there is an active spread of the disease in the community, and it is happening within people's homes. And most of these people are not getting sick, so the hospitals are not overloaded. So the vaccination effect is showing. And over the last 2 or 3 weeks, there's a slight increase in the hospital admissions, and that is largely regional. For example, I was discussing this case with, we have our regular Tuesday meetings for the last year and a half, and in our regular meeting, we keep stock of what is happening all around Kerala. And from Ernakulam district, I can say there's a slight uptick in the number of cases pertaining to the COVID admissions. In Trivandrum, in fact, there's a downshift in the number of cases. And so it's a bit of a mixed spread here, but I can assure you that over the next 2 or 3 weeks, once the festival season kicks in, we can expect a greater number of cases, and I'm concerned about that.
Okay. Dr. Ramankutty, how are you seeing it from your perspective as an epidemiologist? I mean, why is this happening? Why did this happen? And where could it go?
Oh, okay. First of all, let me be very frank. I have no answers. I mean, no final answers. We can only go by what is reported and also give you some plausible explanations. They are just plausible explanations. First of all, the thing is that, this is based on reporting, and reporting itself, the quality of reporting may vary across states, and that is something we have to recognize. But let us kind of discount that for the moment and think that, yes, I do think that Kerala has more number of cases, no doubt about it. But is it so alarming, if you ask me? Not yet, because as Dr. Rajeev pointed out, we have not come to a situation where the hospitals are overwhelmed and, we don't have, can't cater to the people who need healthcare, acute problems and all that. So, but that doesn't mean that we can be less vigilant, because again, as he pointed out, the festive season is coming on. But there are a lot of people who still are not vaccinated or have got the disease in the state, and that means that a lot of vulnerable people and numbers can go up. And right now, of course, the fact that it is not really being controlled as we expected it is definitely a downside, and we have to look at the reasons for that. But I probably think that part of the reason is that there were a lot of in between, occasions when it was kind of, even though there was a lockdown, people were really out in the streets. You could go see that, there was a lot of crowding in many places. And I don't know, perhaps that has led to the situation where it's not going down. So that's all I can say now. I really don't know the answer.
Right, but if you were to look at the number of COVID cases, Dr. Ramankutty, in contrast to testing versus other states in India now, even if you were to look around Kerala, let's say states where maybe potentially there could be a lot of transmission or movement of people back and forth and then potentially transmission, what are the numbers telling you?
Well, as you said, the numbers are like almost half, maybe 1/3 to half of cases every day are being reported are from Kerala, and many districts are reporting like 1,000 to 2,000 cases a day, which is quite not very happy situation. So altogether, I think currently there are kind of statewide about 20,000 at some point of time, maybe between 10,000 to 20,000 cases being reported, which is much greater than all the other states that we see. So this is something really troubling, and we have to find an explanation. I really don't know why it is. It could be the way the people are behaving in the state, but when you look around, you see that this is a state where most of the instructions have been, at least to my knowledge or my observation, have been more or less followed. Like, I don't see many people without masks in the street. Only troubling thing I find is that there's certainly some crowding in the shopping places and other places where people gather. So that probably is, but then there is a trade-off between, how much you can control people and how much because there is a lot of economic hardship because of the lockdown and such. So that is indeed. Yeah.
Right. Dr. Jayadevan, when you look at cases specifically, and you talked about, a downshift in Trivandrum and maybe slight rise in Cochin. Tell us about, what do you understand from the nature of the cases themselves? Are they exhibiting the same characteristics of the now famous Delta variant? Are you seeing any changes there in the manner in which it's transmitted? You mentioned in homes. Is that a cause which is different from earlier, or is there something fundamentally, unique to this situation, which may not have changed, of course, that's re-triggering the spread again and again?
And that's an excellent question. But before I answer that, I must compliment Dr. Ramankutty, because the smartest people say if they do not know something, they say they do not know. And unfortunately, in our country, it is taken in a profoundly negative fashion. But that's the standard all over the world. If you do not have a definite answer, people like me, I would just say, I do not know. Now, coming back to your question, unfortunately, that's really not part of culture here. Having lived across the world, I can tell you that it is seen as an anomaly here. But hats off to him. So back to your question, I was in fact asking the very same question, almost the same words to a bunch of doctors yesterday when we met up online, of course. And then the highlights, I will tell you the highlights because we don't have a lot of time. The first highlight is that the incubation period, that's basically, I get the virus today, when do I get fever? And that's come down to less than 2 days in many cases, and that's confirmed. And that used to be 5 to 7 days, if you remember, from last year. And so with the new variant in, and whatever changes has been happening in the environment and our immune system, it's shortened. So that's one. So it's become incredibly hard to isolate these people. How do you isolate someone when the virus is spreading like practically in less than 2 days? So that's one. The second is vaccinated people. Fully vaccinated people are picking up the virus. I use the word picking up the virus. I'm very specific here. They're not getting sick. They're picking up the virus. And importantly, they're spreading the virus as well. Because a good majority of them are not adept at immunology or epidemiology. So they believe that if they are vaccinated, they can't pick up the virus. And I don't blame them for that. And if you notice over the last year, the narrative has really been, if you're vaccinated, that's miracle. And the Western media have used superlative words like miracle. There's no miracle here. Vaccines are a product that actually decrease your risk of dying if you were unfortunate enough to pick up an infection. That's the long and short of it. But this has been played up by international media and vaccination campaigns saying that you are totally bulletproof. No, that's not true. People are picking up the virus in the throat and nose, and unfortunately, they have dropped their guard and they are mingling like they would not have the virus. So imagine if you believe that you are immune to the virus. Imagine what damage you could do to your family, your workplace, and your social circle. And you multiply that with the tens of lakhs of people who have received vaccines. So that is a risk factor that needs to be immediately addressed, not just in India, but across the world. And whispers are coming up, loud whispers are coming up from the US. You heard the CDC's announcement and the document that they have under consideration right now, which contains alarming information. So that is the point number 2, that is vaccinated people. Hey, you know what? You can't drop your guard. You have to take the same precautions as someone else. There's no need to be alarmed. You won't die. But if you've been vaccinated, you could be carrying the virus home and elsewhere. So that's those are the 2 big ones that came out. There is no change in the age pattern. There is no change in the disease pattern. So the disease, the way the human body responds is the same. There is no shift in the age group either. It's pretty much the same age group, and the male-female ratio is the same. If you look closely at the hospitalization patterns, we look very closely at these things. Over the last month or so, the kind of patients that have come in are not the sickest as they had come in the beginning of the big wave. Remember, in April, May, there was a huge wave all around India, and really sick people were coming in. But this time, over the last month or so, we've not had such sick patients coming in. So that is the present day scenario.
Right. Okay. Dr. Ramankutty, let me come back to you. So, when you look at this phenomenon and this spread, explainable or non-explainable, how do you extrapolate this or potentially extrapolate this to what is happening or not happening in the rest of the country?
Well, there are some indications from these seroprevalence studies that actually the infected people, proportionally infected people is higher in many other states, especially because probably they got the infection because their vaccination is not so high. So which means that the proportion who are vulnerable is low. But the thing is that if there is a variant, then this doesn't really mean anything. So it can actually have a comeback. So to the extent that the same virus is spreading, maybe that bodes well for many states, in the sense the number of people who are vulnerable will be, the proportion of people who are vulnerable will be less. And in fact, in Kerala, that is one of the things that people have put forward as an explanation, that we have a low seroprevalence because we have done the protection very well first round, so we have vulnerable people for the second round. It is like a second generation problem which you always find in Kerala. The public health people say about Kerala that we have brought down they brought down the death rate. So what happens is there are a lot of old people, so you have to, that is another problem. So that these are called the second generation issues. So it might be a second generation issue in Kerala also. I wouldn't rule it out, but the seroprevalence studies, of course, they are random studies. I don't think they have planned it in such a way that you can really extrapolate to the whole country. It is like the sample sizes and all. If you look at it, it's like each state has done its own study, and you are really reading too much into some of those numbers. But still, it does tell you something, that many other states have high proportion of antibodies, people with antibodies in the population.
Right, and the figure I have is 68% for rest of India and about 43% exposure in the state of Kerala. So, Dr. Jayadevan, if you were to now look ahead and look back at the same time, what does this say, in terms of the way the virus will stick around with us? Because if a certain number of people are being exposed or were exposed at one point, and that was obviously very low, and then the virus takes us, as we say, a chakkar and comes back, and then another set gets exposed. And because the numbers of people who've been exposed for whatever reason are low, the potential of more and more groups of people getting exposed over time remains high. Is that a correct presumption?
That is partly true, but I'll explain. I'll take a couple of steps back and then come to your point. The first thing to understand is that the spread of a pandemic in a region is stochastic. Stochastic is the word that is technically used. Stochastic is best explained by looking at a slice of bread and see how mold appears. Mold doesn't appear in every part of the bread of the slice at once. It appears in one part, then another part, and so on. And there are many reasons for it. Because we have the habit of putting things in boxes and organizing things. You know, man likes to organize and name things and classify things. But that is good to some extent. But you can't classify things beyond one extent. For example, if you look at the U.S. now, the southern states of Florida and Texas are having several cases. Louisiana is having cases. Now, if you look at India, if you really look at, forget the state's name, the southwest coast of India and the northeastern states of India. And if you look at the neighboring island of Sri Lanka, the west coast of Sri Lanka is affected. See, if you look at it, there's a pattern. If you look at the weather patterns in these areas, these are the areas with the maximum relative humidity. Relative humidity for our viewers basically is the amount of water vapor that is hanging in the air at any given point in time. And this is a complex topic. I'm not pretending this to be a physics class, but basically there are factors beyond what we know here. For instance, if I am a patient and if I have to give my virus to someone else, the virus has to travel through the air. And there are factors that determine how efficiently I can transmit this virus to the next person. And that is determined by temperature, by relative humidity, by wind speed, by crowding factors, by ventilation, and so on. And so there are two key factors here. Again, I'll explain in plain English. Two key factors here that determine how efficiently I transmit infection to someone else. A is my behavior. If I put my mask down, if I'm careless, I laugh, I talk in a closed room with a bunch of people, yes, I can transfer. Secondly, if the virus itself is able to stay alive inside the droplet for a longer period of time, and also if the droplet that is carrying the virus survives in the air for a longer period of time. Now, these are extremely complex topics, which are actually papers that are published in journals like Physics and Fluids. Yeah, these are physics and fluids papers. So they're really not good for mainstream discussion. But your questions are so precise, I thought I had to throw in this variable, which I believe is profoundly important. Florida and if you look at Texas, have the highest relative humidity, and their dew point is the highest in the nation, in the whole of America. And obviously, there's a lot of political blame factor that is built into the pandemic. But let's just forget the political part of it. But clearly, there are factors that affect the virus spread in the air. It's an airborne virus. A virus doesn't walk or fly. It has to catch a vehicle. And how effective is the vehicle? Does the virus stay alive till its destination? These are factors that must be looked at.
Right. Okay. Dr. Ramankutty, if you were to now look ahead, assuming, let's say, the transmission is happening at the pace that it is today, what's your sense on, this is a tough one, of course. I mean, if you were to look at the life cycle of the virus from where we stand today, considering that we've seen an ebbing of a wave, but very likely the beginning of another wave, going by the fact that we are seeing these surges in, let's say, the western states or the coastal states, where for some of the reasons maybe Dr. Jayadevan pointed out. How do you see this really? I mean, how is the life cycle looking to you as you look ahead?
Again, I would repeat that I wouldn't like to make any predictions, but we always have to assume that the worst will happen. In that sense, we have to be prepared for another wave. That is what I could say. Especially in terms of hospital beds and care facilities, we should not be caught off guard if there is another wave. But I think what Dr. Rajeev said has a lot of interesting aspects. And I think whatever I have read, actually we didn't know much about how the virus spreads. Initially, there were a lot of theories about, surfaces and people touching here and there, and what we call fomites. And that is, the insistence was on hand washing. Of course, it's important, but Now we have come back to, I think there are physicists who have studied this, how people, the virus stays in the air and all that. And they have come up with some interesting theories, especially from Britain. I have read some very interesting theories where they have specified how many people can sit in a room which is so big and like that. You calculate the volume and then so that kind of thing is going on, which means that actually these conditions, local conditions, just like the weather, local conditions mean so much for the spread, and probably that is why we are seeing different patterns. And I think his hypothesis, if I might call it his hypothesis, is very interesting. And I think it has to be probed, and that brings me to another point in India that, unfortunately, I don't know, for some reason, we do have a large research manpower here, but they have not been encouraged to study this. It's like very secretive, and nobody lets you do anything unless you have the government imprimatur, and that has really held us back. We should have studied the processes and come out with more understanding of how the pandemic is working out in India, and especially with the strains and all. I think we have failed to do that. It's a big failure. I think that is one of our cardinal sins in this particular respect.
Right. Dr. Jayadevan, as we come to the end of our conversation, let me come back to Kerala, which has a high number of cases. But as you've pointed out today and earlier as well, that what you need to watch really is the hospital bed occupancy, and that is under control. But as we stand here today, at this point, with the second wave ebbing in many parts of India, but maybe poised to a third, what is it that concerns you most, and what is it that you're more optimistic about?
Okay, what concerns me most is the festival of Onam, which is not a religious festival. It's basically a harvest festival. It involves, that's pretty much like Christmas of the West, where most traders make a year's worth of earnings. That is pretty much what Onam does for most of the trading community in Kerala. So Onam is big, and on the one hand, we need to have people make their livelihood. And as doctors, Dr. Ramankutty, myself, a bunch of other doctors who frequently speak on this topic and write on this, have always stood with the common man for them to be able to open their stores, go to work, make their sales, and so on. So we need to make that happen. And at the same time, we have to make sure that the process of make that happen does not put the community at risk. Now that's a fine line. But I went through the latest guidelines by the government, and which is pretty encouraging, it's so beautifully written. You saw the 20-point annexure from the government of Kerala, which is very impressive. And in fact, took into account the factor that we talked about, the aerosol spread within a room. They talked specifically about the 25 square foot space per person. I was hugely impressed at that, because I was always advocating, including school principals, to consult architects and engineers to improve their ventilation systems. Remember, in a room, there is X cubic feet of air, and there is an air replacement rate for any given room. So if you keep the room completely closed, there is no air replacement at all. And so your risk is very high in such a setting. But if your HVAC system has a good air replacement rate, your risk is lower. And that's pretty much what Germany and other nations have tried to achieve over the last year. And we need to think in that direction. And secondly, what you rightly pointed out is we need to rely more on local indices. I'll give you an example. I know things are better with examples. I'll give you an example. Kerala's curve has been different from the beginning of the pandemic. Kerala had a big peak last Onam, which is why I'm concerned now. And the second peak occurred, believe it or not, in January. And it is these Tuesday meetings that we hold here. We picked that up very early. We found out that there was an uptick in the ICU admissions right through January, and we put out a major press release, and warned the government in January, saying, "Hey, look, the ICUs are filling up. Be careful." And the government immediately responded, and they responded with firm measures, and the ICU occupancy rate came down to 30%. So my point here is, in the long run, every region will have to look at how much of their facilities are being used up, and don't wait until you're full. You got to act when you're about halfway full, because this thing is like a train. It doesn't stop like a car. you put the brakes or whatever restrictions, it'll take about a month to show the effect.
Right. And this, if I can come back on that one point that you had made earlier about this rapid incubation, anything more that you can add on that? I mean, and how should we be looking at it, this incubation, and is there a response that's different from before, even for patients, potential?
Yeah, see, the virus is able to efficiently enter our body. That is the reason why the incubation period is shorter, and that is because the virus has adapted its receptor binding protein to attach more efficiently to our ACE2 receptor. Because basically it is remember the spikes of the virus that attach more efficiently to our system. And there's a way in which it cleaves its spike protein. The molecule is split into two by a pair of scissors, and it uses it as a hair clip to enter and fuse with the cell membrane. Now, I know that's technical jargon, but I want you to know the virus is bloody smart. All right, that's one. So that explains why the incubation period is shorter. What we need to do looking forward is to communicate this effectively. Remember, communication is an important part of the pandemic, and that is one area where Kerala stood out. You know, doctors were constantly on the media media were with the doctors. The chief minister would speak every day, and there were programs on the radio. I was just having a shower in the radio. There was somebody talking on the radio about the pandemic and so on. The communication has been very good, and that's very, very important. It's not about vaccination or mutations. Basically, it's communication. So I think the factor that I mentioned here, that vaccinated people are picking up infections, has to be communicated very delicately to the public, because it can turn around on its head. And people might just stand up and say, look, you know, you guys were telling us that vaccines are good. Remember, people love to do splitting. It's either black or white. Either it works or it does not work, right? There's no in between. But we need to be very careful how we communicate this to the public, because we don't want to push up vaccine hesitancy. Vaccine hesitancy is lowest in Kerala, and that's the combined effort of a lot of people. And that's really the triumph of communication. But we need to be very delicate in the way we communicate this, and so that we achieve what we want to get.
Right. Last word, Dr. Ramankutty, concern and something that you're optimistic about.
Yeah, the concern I share with
from a Kerala standpoint.
Yeah, from Kerala standpoint, Onam is a big concern because, as he said, you know, people want to celebrate Onam. It's a time when people get together, families get together, and friends get together, for instance, and they buy things, they go out shopping. So all this they are looking forward to, and they will be, the government certainly will be forced to at least give some concessions on that front. So, and as a doctor, I can't say that even though I fear what might happen, I would certainly not, say that situation is so bad that you have to keep to your houses. No. So we have to allow this in a controlled fashion, as well as expect, something might go wrong at some point, and then be prepared for that. So that is a big concern. Secondly, again, the vaccinated people, it is a good thing that we have the highest proportion of vaccinated people, and we have to push this. There are concerns about that also. People have been saying that vaccines are, it's more difficult to get vaccinated in Kerala compared to other states. I don't know how far that is true. If that is true, the government certainly has to correct that. But the vaccinated people can spread the disease. That is something that is a message again that we have to give very carefully. Again, you cannot frighten people off vaccination, which would be a very bad thing. But we have to tell them in the correct language that even though you are vaccinated, you still need to mask, and you need to not to go out in crowds and keep all those social distancing norms to the extent which is mandated. So I think these are the things that, and of course the plus point I see is the rising level of vaccination and the people looking forward to getting vaccinated, which is something which I think is unique to Kerala, where people, I don't see much of vaccine. Yeah, exactly. So that's a good thing.
Right. We've run out of time. Dr. Ramankutty, Dr. Jayadevan, thank you so much for joining me and sharing your thoughts. I do hope to connect with you soon and hopefully on a more optimistic note. Thank you so much.
Thank you.
Thank you.